Blood clots can happen anytime in our lives, and we want you to be aware of what to watch out for and what to do to prevent them from occurring. Surgery is one of those times that we're at a slightly higher risk for developing a blood clot. There are two main kinds of blood clots that we want you to be aware of. One being a deep vein thrombosis. Deep vein thrombosis normally shows up for people as pain in your calf. It's a pain in your lower calf that is new or unusual for you. You don't know why you're having it. You didn't injure it. You didn't cause any new trauma to it. You may have swelling in your calf. One calf may be bigger than the other calf. You may have a red spot, or it might be warm to the touch. Those kind of things make you think that you should have it checked out. You can start by calling your surgeon's office, or you can go to the walk-in or the emergency room. The other kind of blood clot is a pulmonary embolism, or a PE. If you ever experience sudden shortness of breath, difficulties breathing, chest pain, something that comes on suddenly, you don't know what you did, you sit down and rest and it doesn't get better, you want to get those symptoms to the emergency room. So how do we prevent a blood clot from occurring? That's the important thing we want to stress to you. First thing we want to do is stay active. The most you can get up and walk around and be active is the important thing. So that means getting up and walking around from time to time. Every hour to 2 hours when you are awake at home, get up and move. Walking down the longest hallway you have in your house, walking around the kitchen table, walking to the refrigerator. Those kind of things are all great things just to help get blood circulating. When you are resting, elevation of your legs is very important. It helps prevent that blood from pooling in your calf area. And exercises with feet and ankles, back and forth with your foot and ankles, circles with them, spelling the alphabet with your big toe. All great actions to do. Every commercial break on TV, every time you turn your page in your book. Do some foot and ankle pumps. Depending on your surgery, your surgeon may ask that you use compression sleeves at home, as well as the other things that we talked about to help prevent blood clots from occurring. The first thing, getting up and moving. The second thing, elevation of your legs. And the third thing, ankle exercises or pumps with your feet and ankles when you are resting. But in addition to that, you may use some compression sleeves at home. Compression sleeves will be given to you in the pre-op area if your surgeon wishes for you to have them at home. We will talk with you about them, but this video will give you a great introduction to them. You'll receive this box that has 2 sleeves in it. They are both exactly the same. 1, 2. Doesn't matter which leg they go on, as long as you're wearing both of them at the same time. Also inside the box will be a charging unit, some great information regarding how to use the sleeves. Patient Start Guide is a great reference guide for you to go back to use. It has step-by-step directions as to how to put them on, also written out directions. Talks about battery indicators and also some alarms that you may hear. We ask that you wear the sleeves for at least 8 hours in a 24-hour period of time. It can be any time of the day or night. We do encourage you to wear them at nighttime if you are able to rest while wearing them. As long as you're wearing them for 8 hours, you can wear them any increments throughout the day or night. You can wear them for 2 hours in the morning, 2 hours in the afternoon, 3 hours in the evening, whatever it is, that as long as you're wearing them for at least 8 hours in a 24-hour period of time. You can wear them for more than 8 hours if you wish to. You're going to wear them on both legs. To put them on, you're going to wrap them around your calf. 3 Velcro straps, put them into place. There is a top and a bottom to the cuff, and on the inside of the sleeve it tells you top, bottom. If you want to remember that the battery box only has 1 button on it, and the screen that will be facing you when you put them on. You're going to position it so that the battery box is in the front side of the calf, so that the cuff that squeezes is in the right location. So securing them onto the leg. Once you have it into position, in between your knee and your ankle, you push and hold the power button. You need to push and hold the power button for at least 3 to 5 seconds to turn them on. They are pre-programmed. They will do everything that you need them to do, and you don't have to worry about them after that once putting them on. If you need to get up and move, go to the bathroom, go to the kitchen, you can walk short distances with them on. I would recommend taking them off, though, if you are walking longer distances. There is a blue battery indicator light that is above the power button. The blue light, or a blue flashing light, is a good light. It means that your battery is functioning and that it has power. If that blue light would be red or red flashing, that indicates that your battery needs to be charged. If your battery boxes will alarm for any reason, that means you need to take them off and charge them. Each battery is separate as far as charging. You leave them right in place onto the cuff when charging. They are attached. And power button is on the top. Charging unit is on the bottom. The plug-in that comes along with them has 2 ports. One plugs into that one. This one will plug into the other one and plug it into the wall. 2 to 3 hours, fully charged and ready to go again for another 8-hour cycle for you to be using them. Again, if these machines will alarm for any reason, the first thing you should do is take them off and charge them. It's normally a battery issue that needs to be solved. Taking them off, charging them for 2 to 3 hours, fully charged and ready to go again. If that does not solve your problem, you can give us a call. Our number is on the form that goes home with you. You can also give the company a call if you have further problems or concerns with using the cuffs.